I'm going to thank you. Let's go over now to Gaza, where we understand the Health Ministry is giving a statement. Let's listen in.
1,200 children still buried under the debris. The Israeli occupation forces against violations against the paramedics resulted in the death of 136 paramedics, the total destruction of 25 ambulance vehicles. 126 hospitals were targeted. 16 are totally of operations. Another 50 medical centers. As we speak, the Israeli occupation forces continue denying the departure of victims with critical conditions to leave towards Rafah border crossing, although the Egyptian authorities have allowed the exit of a number of critically wounded victims. As we appreciate the move taken by the Egyptians, however, those victims cannot depart either from here towards the south or to depart through the border crossing. This move requires collective efforts by a number of parties in order to be followed by similar moves. We need at least to have 800 victims with critical conditions or complicated conditions to leave. We cannot medically attend those cases here within Gaza Strip hospitals, already collapsing hospitals. As a result, over the past few days, we lost many victims who were critically wounded. Al-Shifa Hospital and the Indonesian hospital, the key generators have come to a stop. Now we are working on secondary generators where only 3 critical services can be sustained. This is the intensive care units, baby-born incubators, and surgical operation rooms. The remaining units and wards of the hospitals remain without electricity. During this critical time, the Health Ministry, as we are running totally out of fuel, we will continue to make maximum efforts to keep the supporting and secondary stations working, like the pulmonary respiratory devices and other supportive devices. They will be operated on temporary basis only 4 hours per day. Once again, we call on all the parties, the international community, the international agencies, to act swiftly to have Al-Shifa complex and the Indonesian hospitals be supplied with fuel. Otherwise, even the secondary generators will come to a stop. At that point, it is total disaster. We call on the President, government and people of Turkey to provide protection to the Turkish hospital, the only hospital catering to cancer patients in Gaza. It is totally out of operation due to the absence of fuel. We call on the Turkish President to provide protection to the hospital, ensure the delivery of fuel, and save 10,000 cancer patients. As we speak, we have lost a dozen of them simply because the Turkish hospital has come out of operation. We call on all the parties, the international community, to have a safe corridor opened for the delivery of medical supplies, fuel, also allowing the volunteer medical teams from outside to enter and lend a helping hand. We assure our people And we call on our people to approach the nearest hospital or medical center to donate blood. We call on the International Red Cross to provide with blood quantities in order to lend a helping hand to us, help saving lives. May God accept in His mercy the fallen martyrs, grant speed recovery to the wounded. Long live.
9,227, the latest figure of those killed in Israel's offensive on Gaza. The health ministry official there also pointing out that those casualties include 136 paramedics. Let's bring back in Mahjoob Zweiri. He's director of the Studies Centre and professor of contemporary Middle East politics at Qatar University. Good to have you back with us. So listening to that plea there where he said we're calling on the international community to provide us immediately with fuel. He said that the Shifa hospital, the Indonesian hospital, they're working on secondary generators at this point for only 4 hours a day. It sounds like they're on the cusp of a very grave situation becoming even darker.
It's very sad to hear all of these facts from Gaza and from professional. This is not a political statement. He's a doctor, he's a professional, and he's basically setting the facts that there is a serious crisis, and we are beyond the crisis, actually. And I think what's interesting about the number of killed people in Gaza, it represents only 88% of those who were killed in Ukrainian-Russia war, where the West have an alliance and coalitions to defend that case. It's very sad to see all of this about what's happened in Ukraine and leave all of those people to be killed in Gaza with 22,000 people injured in Gaza. I think the issue about fuel, it's an urgent matter now for 1 week. International community is not acting, is not doing enough effort to pressure the Israeli government.
On that point, though, I'm sure it caught your attention as well, his call on Turkey.
Yes.
The republic, the country, to provide protection.
Yes.
Now, that there have been signals from Ankara about a guardianship, I think, a call for a guardianship arrangement. Is this... Put the pieces together for us, Mahjoob. Is this going anywhere?
Yeah, I mean, Turkish president have made a very clear statement where he said, we have sent medical support, we have sent cars, we have sent medicines, and everything. Some of these is already in Al-Arish in Egypt, and he was pushing Egypt to help to push all of this inside Gaza. I think the problem, as has been said in the last few days, is the bureaucracy on the borders between Egypt and Gaza, and intervention of Israelis to check in every small thing or detail come into Gaza. And that basically caused more problems to the government. There are reports about a lot of medicine are expired now. There are some medicine needs fridge, they need some facilities. They cannot basically protect them. I think the issue now is the talk about Turkish hospital, because it's the only hospital take care of the cancer cases, and already it's important. Already 4 cases has have killed because of lack of
resources.
Yes.
All right. Thanks so much, Mahjoob Zweiri, for joining us.